All righty. Good morning on this August 1st date. Yes, it is officially August, and we are here. We are programmed live from the Neshoba County Fair. I'm Mandy Gunasegura, guest host for the Paul Gallo Show here on SuperTalk, Mississippi, and our coverage today is presented by Covington County Hospital, and I'm very excited, speaking of, to welcome our next guest to the show. We have David Culpepper, who is the marketing director of Covington County Hospital. Friend of the show, welcome, sir, to the program.
Thank you. I appreciate the opportunity to be on with you guys.
Yeah, well, and I'm not sure if you caught our last segment. We had Sid Salter from Mississippi State, and a longtime known political voice here throughout the state, but he talked a little bit about how Mississippi State is trying to train graduates to meet the growing need of healthcare professionals throughout the state. And I know that Covington County really has become a new face of positivity and growth for the rural healthcare system here in Mississippi that, you know, truth be told, has struggled in the past few years of meeting the healthcare need. But could you just give us a little bit of insight of what it is, y'all's approach to rural healthcare that has really helped Covington County to stand out and to reshape and reframe the discussion around bringing much needed rural healthcare to Mississippians?
Well, it's really part of the collaboration that we have with the partner hospitals in McGee General, Simpson General, and also South Central Regional Medical Center. And geographically, that footprint where we're all at allows us to partner and do some things and share some expenses and share some administrative duties to where otherwise it wouldn't be possible. So the footprint is very unique within itself to begin with. Second of all, I think it starts with our CEO, Greg Gibbs, who does a really good job of thinking outside the box and, you know, really looking at innovative ways to continue to reach communities and bring healthcare services and emergency services to those communities that need it. And, you know, in your rural part of the South, it's hard sometimes to get health care and get specialty providers there, but there's unique ways of collaborating and doing clinics on certain days that allows you to fill those gaps and do the things that you need to do to continue to reach those folks, but do it in a cost-effective manner as well, and the collaboration is important.
Yeah, and the cost-effective component, it's so important. And David, I have to tell you, my grandfather, he was a doctor back in Newton County, came and opened up shop in the late 50s, and used to be a one-man operation. But that one-man operation was really set there because location matters when it comes to bringing needed health care to rural citizens, and y'all really fill an important geographic area that is it's just really wonderful to see. Now, I know that y'all have had some recent expansions or investments in swing bed and a behavioral health unit. Could you talk a little bit about that?
Sure, absolutely. We'd love to. Our swing bed unit is, you know, it offers comprehensive care for patients transitioning from acute care hospitals to the home setting. You know, our dedicated providers tailor each plan for those patients to meet the individual needs and prioritize the recovery for each patient. We offer respiratory therapy, wound care, occupational, physical, and speech therapies, along with individual dietary planning to help. Nutrition is a huge piece of that, and then also, again, the activities and the discharge planning. And it's really a hidden gem, but, you know, we're very proud that CareChex recognized us as overall medical care and overall hospital care #1 in our market for 2024. So very pleased to have those awards be recognized for that, but it comes down to our staff that's really dedicated to getting that person, you know, prime example, you know, grandmother falls, breaks her hip. Well, she goes in, has surgery. She's probably going to need a swing bed for a few weeks to get her strength back and make sure that the therapy is on track, and that's what that program and that service line is designed to do.
Yeah, and that's so important. The closer that you can provide that service to actual home, the better it is for the overall health of the patient, of course, and then also the family and their relative support system. So that is wonderful to see. Now, we were talking earlier about potential gaps and finding gaps in having healthcare professionals being able to fill open roles. Is that the case with Covington County Hospital in your recruitment for employees and folks to come fill various roles?
Yeah, we're kind of, I guess, again, kind of unique in the situation that, yes, we're always looking for nurses. Between the 4 hospitals, there's probably some nursing positions that are open, but for the most part, for what we have, we're pretty well staffed for that. I do know that a couple of the other partnering hospitals have some service lines and things that they've opened back up and floors that they've opened back up that they have needs for nursing. But for the most part, we've been very blessed and very fortunate not to be stressed out as far as nursing staff and things such as that.
Well, that's good to hear. And David, real quick, we've just got a few more seconds, but y'all have a blood drive coming up. If that's the case, if you could just let the listeners in on some of the details.
Yes, blood drive with Mississippi Blood Services, and it is today, and they will be in the parking lot here at the hospital.
Wonderful. Well, thank you so much for joining us. We've got to take a